Hello guys, welcome to my channel. For those who don't know me, welcome to the family, and my name is Dr. Padima, and I usually talk about photography, coffee, entrepreneurship and medicine. Currently I'm doing my medical internship in Tanzania and I'm currently enjoying it. Although I must say there's always ups and downs, left and right, but we always try to get through. So today I'm going to be talking about the 21st century. I'm a tech guy by hobbies and somehow by profession. So today I'm going to be talking about apps that we use as doctors in the medical field. I've done a video like this previously where I talk about apps that we use as medical students, of which there are apps that you'd use as a medical student and there are apps that you don't really need as a doctor because your plus is there. So here I currently have my phone and I have all the apps that I'll be talking about here on my phone prepared for you. And for those who don't want to stay long for this video, I'm going to just summarize everything for you. The first app that I have is called MSD Pro. The second one is Medscape, and the third one is MdCalc. The third one is SA Hypertensive. The fourth one is E-Pocket Book. The fifth one is ECG app, and I have complementary apps such as Camscanner and Notability. So I'm gonna go more into depth about those apps. Hope you guys stay for this video and enjoy. So like I mentioned before, the first app that I'll be talking about is called MSD Manual Professional version, of which I usually like using this app because when I come across something that I really don't understand, for example myocarditis, I can actually go up here and I get to read about it, starting from the introduction. Myocarditis is an inflammation of the myocardium with necrosis, blah 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 blah, and this is the small summary of the app. Then it goes into detail the pathophysiology, the etiology, the signs and symptoms, the diagnosis, and then finally we can go to the treatment options, and it even gives you some key points from all that long thing that you've read. So that's one of the things that I like about this app. And the main thing that I actually enjoy about this app is that you can use it offline. So if you're living in a country where internet is a problem, you find yourself a coffee shop, you get this app, you download everything that you need, the offline version, and when you're in the hospital you can just go through the app and enjoy your online version. If you stay longer at the coffee shop, you can get all the images, the videos, and everything that you need on the offline version. Although there's some of the stuff that is not supported as per the offline version, but almost everything that you need is supported. So do yourself a favor and get the app. Go to a coffee shop, download everything. No one will kill you. Yeah. And the second app that I'll be talking about, as I mentioned before, is Medscape. I really love Medscape. I've actually been using Medscape since medical school, and you see once it says offline access available, you didn't finish downloading everything. So I was, like I said before, I was by the coffee shop myself and I was looking for the offline version. So I'll just say maybe later when I go back to the coffee shop I will continue downloading it. And Medscape is a very good app. Like if there's drugs that you are looking for, are not sure of the side effects, for example, let's just say atorvastatin, you're looking for the dosages, it gives you all the dosages and the kind of food that it goes into, of which this is oral, and for whichever type of type of diagnosis you want to prescribe it for, it gives you guidelines. For example, hyperlipidemia, if you're gonna go for that, and it even gives you some of the indications of why you could use it. For example, patients who have stroke, you can give them atorvastatin. Patients who are hypertensive and have other comorbidities, you can also give them that. And that's basically it. And it can also give you the pediatric version, how much you give in pediatrics, and it can also give you the adverse reaction. It also gives you warnings when it's a contraindication to use it, and when to be cautious when using it, and what to be cautious of. And in pregnancy, how to use it in pregnancy if it's allowed to be used. So these are the nice things that it brings, and also the pharmacology behind it. How does it act? Where does it act? Mechanism of action. It gives you everything. So if you really want to go more into depth on why you're using it, you can actually check. And one also nice thing about this app is that you can also check procedures. You get to read more about it. For example, nasal packing in epistaxis, how to go about it. It gives you an overview of everything, the indications of when to use packing, the contraindication. So if you really want to kind of start using this app, you can also do that on the go when having a cup of tea and so forth. You can get all the information that you need. And then what's also nice about this app is that you can use the calculator. If you want to check the GFR in nephrology, you can just go up here, down here, then you start using the GFR. You start using the calculator for everything that you need, of which I think it's a nice feature to have. Quizzes, so when you're bored or on the way home, you can go through the quizzes, read on patient, for example, patient simulation, 57-year-old male with persistent fatigue, low-grade fever, weight loss and lymphocytosis. You go through it, diagnosis, and then you punch in the numbers, but usually these are the ones that are done online. So that's kind of the bad part about it. The third one is one that I actually started using once I became a doctor, and it's called MdCalc, which is a nice app because it's usually mostly about calculations, criteria. For example, if you have a patient that you're suspecting DVT, you'd go here and you'd use the WHO score for DVT. For example, you plug it as does the patient have active cancer, or are they on treatment and in the past 6 months, or are they bedridden? For example, if you have a patient that's bedridden recently, more than 3 days, or had a knee surgery in 12 months, you say yes. Calf swelling of more than 3 centimeters, you measure the centimeters, but no. And then, are there any superficial veins present? Yes. Entirely swollen? Yes. Localized tenderness? Yes. Pitting edema? No. Paralysis, paresis, or recent plaster immobilization of the leg? Yes. Say the patient once had an accident and that happened previously. Documented DVT? No. Alternative diagnosis for DVT, for example, if patient has cellulitis, then like yes, then that's when you check the result. It will tell you patient has 3 points, of which they are in a higher risk group for DVT, likely having DVT according to the WHO score. Then you can take the patient for Doppler ultrasound to confirm if there is DVT or not. There is also a lot of criteria that you can go through. So all you just have to do is type, for example, if you want creatinine clearance, blah blah blah. You can also do this. So this is basically a calculator of almost everything that you can think of, and criteria, calculators, GFR. So if you don't want to use Medscape for it, you can actually use this app. It's very very good. I would recommend it for anyone, anytime, and I like the app. So, and it's kind of free to use, so why not? The third one, when I was going through the internet and I came across interesting guidelines for hypertension, which are SA Hypertensive. I'll put all the links in the bio. Free hypertension practical guidelines. It's a little bit outdated, but not much has changed, especially if you're practicing in Africa, South Africa, in the SADC region, and mostly of Africa. So it's kind of like a guideline, let's say. It has like a book of everything, reading about hypertension management, the goals, management of hypertension, how to start, ACEs, ARBs, CCBs, and so forth, monotherapy, combination therapy, you name it all. So it's kind of like a quick guideline of how to go about the treatment, you see, measuring and blah blah blah, recommendations, lifestyle, and so forth. So you can read more about it. The fifth one is called e-book, which is basically W.H.O hospital care for children. Mostly it's just guidelines. For example, if the patient comes with fever and this type fever, it will give you a number of things to actually look at. For example, fever lasting more than 7 days, what to think of. Take the history. After taking of the history, and you examine the lab investigation, the differential diagnosis that you can think of. And so it's basically, if you are someone who actually knows if you're someone who knows the blue book, usually they call it blue book in Tanzania, and you are acquainted to it, this is basically the blue book of pediatrics. This book actually helped me so much. I actually have the hard copy of this book. So this and this is basically the same thing. So, but instead of walking around with the book, and we're in the ages where people are doing minimalism and so forth, you can just open your phone while drinking coffee. Say a patient, you think a patient has pneumonia, and you're not sure if it's severe or not. So just type pneumonia, search severe pneumonia. Let's start there. Does the patient have this category? Do they have everything mentioned here? Do they fit the categories? What kind of treatment must you give the child? What kind of investigations you must go for? So this is a kind of app to use if you don't want to walk around with the book. But in old school settings, you wouldn't want to be walking around with your phone because it's considered to be disrespectful. So just take your blue book and walk around with it. So this book actually helped me through my internship by rotation in pediatrics. The next app that we're going to go through is called ECG APPtitude. So basically ECG APPtitude is an app that's basically an ECG guideline. It gives you all the information from the general information about ECG, how to approach a rhythm. First you have to look at the regularity of the rhythm, the rate, whether the QR complex is narrow, widened. Then once you know the regularity, the rate, is it sinus, is it tachycardic, is it bradycardic, then it gives you waveform analysis, the P waves, PR interval, so forth. And it also gives you places where if you have a patient with atrial fibrillation, now it's basically giving you conditions that a patient can have. For example, atrial fibrillation. In atrial fibrillation, what do you see? Obviously, you're going to see irregular rhythm, and also whether the rate is controlled, uncontrolled. Definitely, you won't see any P waves. Is the QR complex narrow? So it gives you a clear indication of what you'd see in a patient with atrial fibrillation. And if you actually want to go through all the diagnosis that one can come across, you can just go read through it while having a cup of tea, or while sitting with friends and you're bored, or just while standing in the daladala or in the bus, or even on a boda bajaji, or on the way home from hospital. That's what you can go through, and it's free of charge. You don't have to pay anything. Once you download it, everything is in, locked and ready to go. Remember when I was talking about MSD Pro, that it gives you all the information that you need? This app is basically MSD Pro but for ECG. So it's a kind of guideline that you can go through and read from the basics to the diagnosis and to understand. Then you know when you open an ECG, okay, I know this, atrial flutter or atrial fibrillation, what's the difference? You know those things. So you can try it and check if it works out for you. So the next app that I'm going to be talking about is called EML Guidelines. So EML Guidelines is an app that mostly people in the SADC region use. It's a South African app which has all the guidelines for standard treatment and so forth. So the app is so good for me. I prefer using the app. But the disadvantage is that currently I can't find the app on my phone. So I actually ended up having to download something for it. So there is actually, if you go to the University of Pretoria website, you will find the PDF version of the app. University of Pretoria's website, you'll find the standard treatment guidelines and essential medicines list for South Africa. And this is basically the app. Is that the app is a little bit easy to use, user-friendly, and you can walk around with the app. Well, this you can also walk around it because it's a PDF version of it, so it's not that bad, but it would have been nice with that, because with the app you just type what you're looking for and it goes straight to what you're looking for. Whereas with this PDF you have to actually manually scroll. Okay, I'm looking for this. Okay, I'm looking for gingivitis and what are the treatment methods for gingivitis. Okay, here they are. Go through them. Whereas with the app, everything is put so nicely for you. And come on, if you can make life easier, why not? And if any of the EML guideline developers for iPhone, MacBook, if you are there, please help us bring the app back onto the Apple Store. What's nice is I still have this phone. Mind the line, this phone still has the app, so I can actually just go to clinical guideline. See, this is the app. This is how the app actually looks like. It's kind of like a simple app. It has everything: primary health care guidelines, hospital level pediatrics. So once you just go in, it gives you everything. That's why I'm saying this is more organized. Patient has angina, how to treat, description, general measures, the treatment, and yeah, this is basically how you use the app. And I like using the app because it's kind of easier for me. So whenever I want to use the app, I use it on my hospital phone, and it is good. Those are the 6-7 apps that I actually use as a doctor. But like I said, I have some of the supplementary apps that I use, and I find them to be very useful. One of the first apps that I actually use is called Camscanner. With Camscanner, I basically just take a picture of anything. For example, if someone is teaching me something and they're writing on a piece of paper, I take a picture of it. It comes looking like a PDF, a scanned version of the PDF. And I like that it's easy to make a PDF out of it from Camscanner. So you can actually pile up everything for later and then read it as a whole. So if you're someone who likes to write, then take the Camscanner, make it a PDF and send it to people if you need to, especially if you're working in groups. So that's one of the things that I like about it. So one of the apps that are supplementary for me that I like to use is called Notability, and I use Notability on my iPad to write notes. So once I write notes, I can transfer those notes to my phone and read as I go about. For example, if I try to understand something and I still totally didn't get it, and I want to read more about it from my handwriting on the way, I just open the Notability app, and because it's synchronized, it automatically opens and shows on my phone. And also the notes that I still have from medical school, I still have it on Notability, which is so good. That's what I love being in the 21st century and being a trainer. Those are basically all the apps that I use as a doctor in 2021. Those are the apps that I use. Obviously with time, some people prefer other apps. New apps keep on coming. So if there's any app that you guys know of that you think I should try, please put them in the link. Please link them down below in the comments, and let's chat about being doctors in the 21st century. Hope you guys have a good one, and hope you guys enjoyed this video, and till next time, cheers. Dr. Padima signing out, and goodbye.
Yeah, hey. Yeah, hey. You're talking about me, babe, like I'm not a person. Hey, yeah. You're talking about me, babe, like I'm not a person. Yeah, hey, hey. You're talking about me, babe, like I'm not a person. A human being, not an ape. You can see what differs. Feeling so high in the sky when you got them all. Playing Texas, I can see what the break is. You're talking about me, babe, like I'm not a person. Consider Mr. Waste, you ain't playing safe. You're talking about me, babe, like I'm not a person. Consider Mr. Waste, you ain't playing safe. A lot of people mourning in the currency. People making offerings in home streets. I get it how it happened, it's so undeserving. Full in the streets, making way as I can see they have. Everybody had a chance, but some did not use it. The resources are still taken, but everybody's fine. Opportunities, the present, we own in the crowd. How can we cannot see all the cut and paste? You making simple facts like you late for supper. Within the point when you're quiet, thinking about your friends. Happens a lot in middle age, exaggerate. Who took the inner part and nothing outside? I do wish you all the best in your lifetime. To stimulate all about the double-A plug. Saying answers to me, I'm not a paper clip. Socially without me in the book of hearts. Steps hating on me and making bullet holes. The product inside the package is undecisive. I'll show you ways none of you will recognize. Learn to look on the floor, niggas not allowed. You're talking about me, babe, like I'm not a person. A human being, not an ape, you can see what differs. Feeling so high in the sky when you got them all. Playing Texas, I can see what the break is. You're talking about me, babe, like I'm not a person. A human being, not an ape, you can see what differs. Feeling so high in the sky when you got them all. Playing Texas, I can see what the break is.
Yeah, girl talking about me like I'm not a person. Yeah, you need to listen, I can do this shit. Ayy, got my boy in the studio, wearing the Adidas, thinking that we Jesus. Ayy, go, yo, every day, do the same shit like every day, do the same things, no change in the game. Got the fame in the game, going out like I'm flame. Ayy, yeah, we trippin', yeah, we cashin', yeah, we trappin', yeah, we rappin' like, yeah. Talking about me like I'm not a person. Hey, yeah, you need to listen.
You're talking about me, babe, like I'm not a person. A human being, not an ape, you can see what differs. Feeling so high in the sky when you got them all. Playing Texas, I can see what the break is. Playing Texas, I can see what the break is.